Mvskoke Creek Nation's Secretary of the Nation of Commerce, Terra Branson, is with us today, and we're going to talk the CARES Act funding and how the Mvskoke Creek Nation has formed a committee to see how we should use this funding. Can you kind of give us a little bit of your background, Terra? I think Jason kind of introduced you pretty well when we did a presser earlier in the week, and he kind of explained that you have some unique background that makes you pretty good at handling these kind of federal policy kind of funding type issues. Can you go into that a little bit for us?
Sure. So when I graduated from college, I wanted to work on Native policy. So I had my first job out of college with the National Congress of American Indians because I did what every 22-year-old does, and I assumed that all policy happens in Washington, D.C., which I learned quickly was not true. But I learned a lot while I was there and spent a lot of time working on the Affordable Care Act implementation and learned a lot about health policy. And since that process was kind of towards the legislative end when I graduated and then really launched into implementation, I think I earned a passion pretty early about federal legislative implementation. And so I am uniquely skilled or positioned to be able to provide support to leadership in their decision making around some of the CARES Act and other coronavirus relief
Awesome.
activities.
Thank you. Could you give us a little bit of info on just exactly how the Mvskoke Creek Nation, we received our federal funding for the CARES Act in $282.2 million on May 5th. Can you tell us a little bit about the team in those early meetings and who they consisted of and how that who was weighing in at that time?
Sure. So the team has really changed over the period of the pandemic. Leadership started bringing cabinet members together fairly regularly in early March, even before the emergency declaration. And so as the legislation unfolded and we learned more about what was going on in DC through our contacts and our ambassador, that team grew and shifted based on needs at any given moment, frankly. But the primary team for the CARES Act, specifically to the Coronavirus Relief Fund, has included both principal chief and second chief, many different cabinet members depending on the data that we're trying to pull in. Some consistent players have been the controller, myself, the chief of staff, the Secretary of Interior Affairs, and the Community and Human Services Secretary. So we've been working as a team, and then it kind of grew as we started to prepare data for the first certification, which was due in mid-April. So that team grew from kind of the core cabinet team to include all of our MCN-owned enterprises, representatives from their groups. So mostly CEOs from those groups. We were leveraging their knowledge and experience in the private market to gather data and submit that data to Treasury. And then when we received the funding, we had a call early that morning with the expanded team to talk about we got the money and what are we going to do? How are we going to put this team together? And that's really kind of when the more formal team structure started coming together, and we made the invitation to national council members.
And so now with that core group that began and then the inclusion of the council members, I was watching, you guys did a really good video through our public relations department that kind of highlights how citizens can reach out to their council members and they can kind of weigh in on how this funding or how they believe this funding, would benefit them as citizens. So that gives this a well-rounded committee a lot of access to both the administrative side and then the citizenship, citizen population side.
Sure.
Let's see. So I understand that this is like a meeting that kind of is taking place on the regular, and probably we couldn't all just get together right now in the same room because we do have all of these pandemic, restrictions and everything. Is there going to be some kind of plan decided, written out that the government will be sharing out, kind of, so citizens can follow along and see what services are going to be impacted or helped with the funding, or how the nation plans to use the money? Is that something that you guys are working on right now?
Sure. So we have been working with various subject matter experts across the government to talk about and identify the needs for citizens and their programs, where there are opportunities to expand, where we've seen additional needs. So one area that we know that has seen additional need and an uptick in traffic is around the hardship grant that we provide through social services. So we've been meeting with them. I've been meeting with the Department of Education. We've met with tribal construction to talk about some infrastructure opportunities that might be tied to coronavirus and how to make our employees feel safe. So we've been leveraging all the talent that we have here to be able to answer some of those tougher questions and come up with ideas and projects that will better support both the government and citizens anywhere. And the team's kind of vetting those ideas. And as we come across one that we really feel like needs to happen in this first initial funding application, we are assembling those documents, coming up with applications and policy to support early implementation. As the committee makes decisions about those programs or expansions, we're putting together budgets and we're taking those back to the committee. So our plan internally is to kind of put together a full spending package for National Council to review and provide comments on, or send back ideas to us, and then hopefully get close to an authorized expenditure legislation so that we can really start implementing this. I know, we know that citizens are suffering, and it's important that we move quickly, and I really appreciate everyone's patience with the team while they sort out some of the larger issues and details, because we want to make sure it's as streamlined as possible and as easy as possible to access those services.
Sure. And so, like, for the citizens who are kind of watching at home, when she talks about these expenditure packages that go through legislation, what a citizen would be looking at would be when you look at a national council agenda and it says CARES Act funding expenditure and there's a dollar amount. That's how you know that this money is being set aside for this specific, and maybe it goes into education, or it goes into social services, or whatever the case may be. We'll be able to follow along at home, kind of watching our government kind of make these transactions and designations for the money and part it out where it needs to be going.
Yes, ma'am.
You mentioned the guidelines provided by the U.S. Treasury in the video that we've seen. Can you give us some insights? And you shared some documents with me, which we'll probably be putting in post-edit, and I'll give those to Jared, that just kind of what the guidelines say is allowable. Do you feel like they're vague guidelines, or are they very specific? That kind of scenario, so we can kind of learn what it means to stay within federal regs.
Sure. I'll quote someone else. I won't take ownership over this, but someone said, I've never seen a federal agency write something so specific and ambiguous at the same time. Right. So Treasury's only put out 2 documents to provide support to all governments. So tribes are being included with states and territorial and local governments in that guidance. So some of it, because tribes are unique in the family of governments, in that we don't have a tax base, we rely on revenue generating businesses to bring in funds so that we can support our citizens. Some of the guidelines are a little bit difficult to interpret in a tribal context. So the 2 documents that Treasury has put out are it was a document that they're calling their guidance, which was on April 22nd. That's the shorter document that really kind of relies on the statutory language within the CARES Act related to the Coronavirus Relief Fund. And then later, after we received our distribution, there was a set of just before we received our distribution, there was a set of documents that came out that were frequently asked questions. And that was on May 4th. So states and local governments received their funding before tribes. So a lot of these questions were generated by states and local governments. So we're trying to interpret, this is how a state works. This is what it looks like on the tribal side. And we're trying to put those things together. And sometimes they do this, and sometimes, we totally miss each other. And so that's really why the team is so important, because ultimately we've got to have some consensus and be able to stand behind some of the decisions that we're making.
And I'm imagining that some of these questions that the state would ask would really vary a lot differently than what a tribe would ask. For instance, people throw out the terms of, hey, we need to put some of this aside for per caps. Well, I've never seen a state do that. So they wouldn't have asked that question. So it's something that's kind of in the gray and unknown area.
Mm-hmm.
We saw the information published in the video about how the at-large citizens are eligible to benefit from the CARES Act funding too. Can you kind of give us some examples of how they might benefit? And is it through service mechanisms, or are they being represented specifically on this committee, and how? I guess that's a lot of questions. I'm sorry.
Okay. I'll try to parse through them and correct me if I miss one. Like I said earlier, there is not a single person on the globe who is untouched by the coronavirus pandemic, whether they've experienced it directly in their family as an infection, or they're experiencing the squeeze at the grocery store right now. We recognize, or they've had a job loss or an income disruption, they own a business, no one's untouched right now. And so we really were cognizant of that, and we've received some internal direction to create services and programs that expand eligibility. So some of our social services programs now are dictated by federal regulation, where we cannot serve at-large citizens. But in this case, the Coronavirus Relief Fund allows us to provide services to citizens no matter where they live. And so we're trying to be really cognizant of that as we construct citizen direct assistance type programs. And we've had lots of conversations about how to do that. It's actually really impacted how we estimate the total cost for some of those programs. And so one of the reasons that we're kind of coming at the coronavirus fund a little bit differently than we would other types of federal funding is because it is kind of hard to project how many people might be able to take advantage of the program. And we want to make sure that we budget appropriately and the funding, if someone needs it, is there. And so it kind of makes some of those discussions lengthier, but there's a group of folks who are committed to that, and we've done a lot of projections and estimates based on our citizenship data. So while at-large citizens sometimes feel like they can't access services, this is one of those opportunities where we're really going to try and make sure that they have equal access, and that we've streamlined the process in such a way that they can submit everything virtually and do it pretty easily. So we're really cognizant of all those kind of different pieces along the implementation timeline.
So I understand, and we're kind of like going to switch gears just a little bit from just straight services to some of the like kind of questions I gathered from just like citizens' comments and things like that from social media, from someone dropping me a line or something like that. And this next part is probably full of that. But I understand that the CARES Act is geared towards COVID-19 related expenditures. And so that seems to be the really big, like, and almost vague kind of umbrella that it's operating under. Is there any restrictions on the nation's economic entities being able to recoup losses? And I'm kind of specifically thinking, for instance, our gaming facilities. They're getting ready to open, and they're making a lot of changes in some of the things that they're investing in to keep people safe. For a long time, they were keeping people safe by just keeping everyone home, but maintaining a large payroll. And then our, MMBE or even community hospitals that serve all the public, really, in terms of the expenditures that they've put out. Is there any restrictions on that?
So the initial guidance was a little unclear that Treasury sent out, but the FAQs have clarified some of those opportunities, because states operate revenue generating program or entities. They operate golf courses and zoos and other things that require people to interact in a public situation that have been closed down and now have a revenue shortfall. The guidance was pretty clear that we are not allowed to use coronavirus relief funds to shore up revenue shortfalls. So we have to do we have to approach it differently, right? So we've got to identify expenses that are within the guidelines, within the statute, that will allow our businesses to safely reopen and to recoup some additional costs that they're going to incur as a result of the pandemic. So there are opportunities to do that. It's just about how we structure it and how National Council supports it. So we are having internal discussions about that. Those were some of our earlier conversations because we know that we're reliant on those revenue distributions back to the nation in order to maintain governmental services and employees. And so it is a primary priority for us to figure out ways to support not just gaming, but Mvskoke Nation Business Enterprises, One Fire Holding Company, and all their subsidiaries. Those are all jobs in our community that citizens and non-citizens enjoy. And we know that our hospitals have seen an increase or a reduction really in their revenue generating activities, but they've seen an increase in need. The state has put a lot of new restrictions and requirements on them to prepare for surge activities. And so I was just on a conversation this morning, a call with Secretary Terry this morning, talking about some of those requirements that they've had to put into place and what kind of costs that they've incurred. So we're trying to think about those expenses globally while also meeting the sort of ambiguous guidelines that we've received from Treasury.
So I'm kind of like imagining this playing out, and I'm going to attempt to, and I hope no one like tries to get really upset at me for doing it, but like break that down into like the everyday terms. So our casino was closed for a really long time and payroll was already budgeted. So that's probably something that in that clause of things you've already budgeted for isn't going to qualify. But as our casinos opening back up, maybe they need more people to do more cleaning, or maybe they need special equipment, and those kinds of things would kind of be in that realm. And the same for hospitals or the business enterprises and things like that.
Yeah, I think Secretary Terry told me this morning that the governor required all state certified hospitals to prepare for a 40% increase in their facilities. So that means, we need additional beds, we need additional equipment, we need additional staff to support those needs. We had nurses who were working overtime where staffing was required to kind of move people around to do those initial checks before people come in the door. So there have just been expenses that we really didn't budget for. They might have been placed somewhere else, doing a different task, but we had to move them into the hospital to be able to provide those services safely.
Awesome. Okay. Is there any specific use of CARES Act funding that is just immediately and easily disqualified by the federal guidelines or Mvskoke Creek Nation code? Like, I'm trying to think of any scenario that right off the top of, it's easy to identify and say we can't do that, kind of like we said with the payroll for the casino or anything else.
Sure. So that actually was outlined in the initial guidance on one of the final pages. It's a very short list. I think there are lots of other things that if you kind of got into a discussion with someone and you're trying to tie a specific project into a coronavirus related activity, sometimes it fits and sometimes it doesn't. And that's kind of the discussion. Some of the ineligible costs that Treasury listed on their list or any damages that are already covered by insurance. So someone else is already paying it. That's not something that we'll be able to recover under the coronavirus relief fund. The same goes for federal entities. So if we have federal grant funding that is eligible or has already covered an expense, we can't go back and recoup that using these funds. We're also not allowed to use it for payroll or benefits for any employee who wasn't specifically working on a coronavirus activity. Or provide workforce bonuses or severance pay. So there are some restrictions that provide protections to both the fund and the government, and we have to meet those requirements. So we've talked about those, and we've come up with maybe some other solutions that get to the same issue. So some of it's really just about having those experts in the room and tossing around some ideas and identifying whether or not those are going to work in our construct, right, and within our law and within the guidance that the federal government has provided.
Has there been, I know that there's been discussion about future needs. That's something that I imagine is probably one of the hardest things to kind of gauge because this has been such and who the heck knows what kind of scenario. But what is the nation really kind of concerned about right now or thinking about on that future needs side?
So we know that there were lots of plans, that the nation had in anticipation of revenue from all of our entities. And so we always have a lot of big ideas, and we're always, as a government, trying to make bring modernity into the government. And so there are some opportunities there where we could support capacity development, right? And so we're really looking closely at telehealth projects where we can provide additional infrastructure to our health system so that patients who really shouldn't come into the facility because they're either high risk or they don't necessarily need to come in. So don't take the risk if you don't have to. So we're looking at doing some of those infrastructure projects that really fit in very well, with some of the work that we're already doing, and could long-term provide increased services and expanded services. And so that's one really easy one to identify. We're also looking at some broadband development. There were other activities that were occurring prior to the pandemic that we can tie this funding in to provide better infrastructure support in some of our areas within the jurisdiction that don't have great internet. We know that that's going to be a need. No matter what happens in the fall, if parents don't feel safe sending their kids to school, they're going to have alternative options. And the nation wants to be able to provide services or at least some support to those folks who are making those decisions that are in the best interest of their families. And so it's our responsibility or our opportunity really to be able to do that for those citizens. So we're trying to figure out ways to put those into the budget.
That was like a really kind of big question on everyone's minds as the kids got sent home and they said, okay, we're going to have this plan for, school remotely. And I thought, wow, okay. It's kind of a challenge even in my house, which I have good access to internet, but I don't have laptops for everyone.
Right. You may not have the hardware. Exactly.
And then I imagine other families might be even like, I don't even have, Wi-Fi or access. The libraries were closed. You couldn't go there. And so it did create pretty much a pretty wild scenario. I think the schools did some packages and paper wise, and you could kind of get it done. And so, with all these needs that we're looking at currently, and then trying to project a future that we don't really know a lot about, what is the time restriction on COVID relief funding? Is there any scenario where if you don't lose it, you lose it? You don't use it, you lose it kind of thing?
Most certainly. I think that's actually why leadership identified a team early on, because it's going to take a lot of people to make this all happen. And we have a lot of folks who are committed. So the CARES Act sets a statutory deadline for use of the coronavirus relief fund as December 30th, 2020. So it's a very short time frame, unfortunately. I think that there is support nationwide from tribes to consider extending that deadline, and I know that there was some discussion in the House legislation that went over to the Senate. So our congressional members are listening to us. We've talked with each of them. It's a lot of work in a very short amount of time. Not something that we can't do, but it is going to be an effort on our part, and we want to be cognizant of that timeline as we move forward, because really just this initial funding, that's just one portion of the fund. Treasury has came back and asked for additional data from us, so we submitted additional data on Tuesday for a second disbursement, which should be the balance of the fund. They told us that they're going to distribute the remaining 40%. So we could have additional funds, in the next 60 to 90 days with even less time to deploy. So it's really important for us to make some decisions as quickly as we can, and with some forethought and some development.
We've seen a lot of different tribes handling things a lot of different ways. Some are considering per cap, some are considering infrastructure. I think one of the stories that I looked at was maybe the Navajo Nation is considering water infrastructure improvements. What's the general temperature of the committee right now on per capita disbursements or upgrades to infrastructure such as broadband and water infrastructure?
So I think the committee is considering kind of everything on balance, right? So we know that there are lots of needs, but there's a finite amount of money. Even though it's a lot of money, it's still a finite amount, and we've got to make decisions. And so we're trying to find ways to meet all of the needs with the amount of money that we have now. We have had internal discussions about per caps. And we're still considering all of the options. There has not been a decision one way or the other. We're trying to make valuations about what kind of risk that runs both for the government and individuals, and then just provide recommendations and identify those issues for leadership. So ultimately, there's lots of smart people working on this group, and we all have our own thoughts and opinions, and it's our responsibility to kind of wrap all those up in a package and tell leadership, here's your options. And so that's kind of the process that we're going through right now. I think on the infrastructure side, we really do want to be able to make some of those investments because we have a unique opportunity really to leverage federal funds to provide local support. And not just to Creek citizens, but to our communities. And so we know in some of our areas where broadband is harder to access or it is just cost prohibitive, there might be ways for us to reduce those costs or to partner with private and public entities to deliver better services. And so we have to kind of swing that in the balance when we're making decisions regarding direct citizen support and making those long-term investments. And those are harder to evaluate for the average citizen because they have immediate needs now, and we've got to be able to do both if we can. So those are kind of the discussions that we're having internally.
I know sometimes I seem like there's a kind of some population, some of our population of citizens are for it, some are against it. When it comes to the per cap, sometimes I wonder if a distribution would knock folks out of other services. I've seen that play out, and that's always really rough to think that a few $100s here prevented you from qualifying for a few months worth of food assistance. And is that a kind of scenario that could happen if that was considered?
That's certainly something that we've discussed as a team and tried to identify, how it might impact. One area that we had a very specific discussion about was access to temporary assistance for needy families, because that's a federal program, so we can't change, eligibility for those programs, and whether or not if we were to do a distribution, would be counted as income. And because the guidance from Treasury has been really ambiguous, we could actually end up in a situation where maybe we don't count it as income today, but 5 years from now, they considered it income, and now we owe a debt. All of those are things that we're trying to evaluate and provide to leadership in their decision making. They're not easy decisions. So we definitely appreciate your support and thoughts. If you have ideas or concerns, please let your council members know so that we can bring those to the table and really think through them.
We understand that the advocating part of CARES Act funding was very much a national collaborative effort between tribes and the tribal organizations that kind of help bring everybody together. Has there been any tribe to tribe consultation on CARES Act funding expenditures and how it's going to be spent? And in the scenario of that, should the tribes need to team up and advocate again that this was a good decision for an expenditure and here's why you shouldn't be penalizing us for it? Is there anything like that going on?
There hasn't been a lot of discussion among tribes about any particular expenditures, but Chief Hill has tasked the group with finding and identifying the best practices that tribes are considering across the nation. So we've engaged in lots of discussion. We're leveraging our ambassador to kind of keep his ear to the ground in DC and let us know what other tribes are working on and what questions have come up in their debates, and that has really enlightened some of our discussion. And so there are some working groups, where individuals on the team are working with outside groups and bringing that information back. So we really do kind of have a network and really an assignment from leadership to bring those ideas back to the group and to help the nation make decisions that are on the forefront and really represent solid decision making on behalf of all tribal nations.
Awesome. Well, I think that's just about all the questions I have. Do you have anything you wanted to leave with us? Anything I might have missed that you wanted to mention?
Sure. I just kind of wanted to jump off on that last point that I made. This is a a historic distribution to tribes, and we did work really hard. Our advocates, kudos to them in DC, working so diligently to make sure that this fund was available and that we were treated equitably among the family of governments. States, territorial, and local governments were eligible for this funding equally to tribes. And it's really important now that we take a moment and consider all the decisions that our predecessors have made and move forward with those thoughts in mind. They put practices into place for our government that would allow us to withstand times of uncertainty like this. And so we have to continue to make decisions that will allow the nation to prosper during uncertain times, because we don't know what the next 6 to 12 months are going to look like. I'd love to trust everyone's predictions. And I know that we're getting smarter on this issue every day, and that's great. But until we just have hindsight's 2020, we just don't know. And so that's kind of the situation that we're in. And so when we sit down as a group, I think that those are all things that we consider and discuss regularly as we prepare programs and recommendations for leadership to consider.